Okay, so here's what we're looking at in the medial compartment. We're just getting started. We've already harvested 2 nice hamstring tendons. This is your medial meniscus. We're going to focus a little bit better if we can. There we go. And you've got this bad bucket handle tear. It's reduced now, but look how thin it is. It really just kind of sheared off. And something that thin won't hold a stitch. You can see how it's all the way detached there. So I've been looking at it for a minute already, trying to figure out if there's any way we could expect that to heal. And I just don't think so. Because the bottom half of that meniscus is already gone. It's already become a loose body or a loose piece. We're just making sure it hasn't folded up someplace else that we can get to it and still use it. But so far it looks like, see here, this is where the meniscus is normal. Here's the top. Here's the bottom. That's normal. It stops being normal right here, and you just have this little thin leaf. And we've lost the bottom. I'm trying to see if it's folded up anywhere, but it's not. Okay, we'll get to work here. Okay, so we've resected this meniscus back and removed the part that was unstable and torn. And again, this is on the inside or the medial side of your knee. Okay, and so next we're going to work on the ACL, the remnant of it anyway, and get that cleaned up. Okay, so here's the ACL tear. We haven't done anything yet, but you can see how this is really attenuated and thin and wispy, and this is why the meniscus tore too, part of that same injury. So we're going to remove this tissue. You can see how just with a little bit of shaving, we can see all the way to the back of the knee. So we're going to take out what's left of this right here so it doesn't cause any problems with our reconstruction here. Come, lift up on the ankle for me. Let her push. Okay, so this is the lateral compartment. You take the ankle and lift straight up towards the ceiling. Keep the knee bent. And you push down. And as we look in here, so far so good. We're just flushing the area out right now. Okay, so we're looking at this lateral meniscal tear. It's doing its best to heal. It's not displaced like the medial bucket handle tear you have or had. And as we look here, this is the posterior horn of the lateral meniscus. You can kind of see the tear on top here. And if we lift up, we can see it doesn't really quite go all the way through. But we can certainly see that it almost does. But it's trying to heal up here. See that? And I don't really want to pull that apart. We get to the popliteal hiatus and we can't really anchor it to the capsule there. We could do a hay bale stitch, but that's about it right there. And I just don't think I can make it look better than that if we can just get that to heal. So I'm going to look in the suprapatellar, you can let go, in the suprapatellar pouch next. And we'll look up at your patella here at the top of the screen. Shaver. And so far this looks pretty good. Okay, so we're just passing the graft into position here. We're going to flush the knee out a little bit. There you can see what we call the endo button going up into the tunnel. Behind that is the new graft. And we've made some little marks so we know exactly how deep to go. Okay, and now that we have the button flipped, we can pull back. And there's the new ACL. We'll get a better picture of it for you in just a minute here. You can see the biobrace graft right in the front there. We'll clean up some of the soft tissues and get a real good picture here. Table all the way up. Okay, so there's our new graft. I'm happy with that. We're going to tension it on the tibia, and then we're going to go home. So good luck to you now. I really hope that does the trick for you, okay? Bye-bye. Okay, so here's the graft in position. It looks good. We've fixed it on the tibia now, so it's completely secured. And that's the way it looks. You can see the biobrace right there. There it is coming out of the tibia and going up to the femur. The screw is just below the articular margin. And that looks good up there. So good luck to you now. Bye-bye.